Hello, everybody, and welcome back to Kaplan's USMLE Step 1 Qblast. I'm Dr. Jason Fernasiak, and we are here once again this week with another clinical vignette. As always, we're going to go through the right and wrong answers and the high-yield topics. These topics are going to help you gain additional points on the boards and help you take better care of patients on the wards. Without further ado, let's jump into our clinical vignette. We have a newborn who was born at 38 weeks gestation. She's brought to the emergency department because of recurring seizures. Further evaluation shows an inherited activating mutation in the calcium sensing receptor in the parathyroid gland and kidneys. The parathyroid hormone reference range for this laboratory is 10 to 65 picograms per milliliter. Which of the following is most likely to be seen in laboratory studies? You can see here the different option choices A through E, and various levels of serum phosphorus, serum calcium, and parathyroid hormone. Review the reference ranges that are given to you by the USMLE in order to determine the correct combination of laboratory values. The correct combination here is C, a low parathyroid hormone, a low calcium, and a high phosphorus. This patient has familial hypoparathyroidism. Let's review some of the key facts here. First, it's a constant activation of the calcium sensing receptor in the parathyroid glands, which leads to suppressed secretion. Because of the decreased phosphaturitic effects of parathyroid hormone, phosphorus levels should be elevated. Loss of parathyroid hormone-mediated bone resorption and renal calcium sparing will result in hypo or low calcium levels. Hypocalcemia manifests in this child in the form of seizures. Low calcium levels can lower the seizure threshold, which is why we see the clinical picture here. High-yield takeaway points for familial hypoparathyroidism. There's a constitutive or constant activation of the calcium sensing receptors in the parathyroid glands which suppress parathyroid hormone secretion. Therefore, there will be less phosphate, which is lost in the urine, and serum phosphate levels will be elevated. The lack of parathyroid hormone affects both the bone and kidneys and results in hypocalcemia. Hypocalcemia can lower the seizure threshold and result in a clinical presentation with seizures. That is our clinical vignette for this week. I hope that you've learned a little bit about familial hypoparathyroidism and can take this information with you to the boards and the wards to increase your score and take better care of patients. I'm Dr. Jason Fernasiak, and I'll see you again next week. Take care.